Hey guys, how's it going? I'm Dr. Alvarez with Endobariatric.com, and today I am interviewing a very special patient, former patient of mine. This is Laura. How you doing, Laura?
Good, very good.
And Laura is visiting us for a second time.
Yes.
And the first time, well, you came here as a patient.
That is correct.
And now you're here, bringing somebody else for surgery.
College friend of mine.
College friend of yours, and she had surgery today. She did great, by the way.
Yes, she did.
And I asked Laura if she would be willing to do this for you guys, for you. It's very inspirational what she has gone through, what you have achieved, and it is very worth sharing, and that is why I ask you as a big favor. So, Laura, maybe tell us a little bit about you. Where are you from?
Sure. I'm from Ashland, Missouri, so that's real close to Columbia, which is in the middle of the state.
Okay.
And do you want to know?
What do you do? Well, I know you work in the medical field.
I'm an occupational therapist.
All right.
And I work at the University Hospital, and I've been an OT for about 18 years.
Okay.
So
you got a big medical field background there.
Yes, I do, and I love it. I love what I do, and that's part of the reason why I had the surgery, is because I was finding that it was harder and harder to do what I love to do.
To keep up.
Yep.
Yes.
Yeah. I was in chronic pain every day, low back pain, and sometimes it would limit me actually being able to come to work. There were days that I wasn't able to even stand up completely straight.
And I know you had visited an orthopedic surgeon?
Yes.
Because of the aches and pains you had?
I had 4 herniated discs, and I was having so much pain that I visited an orthopedic doctor, and he recommended surgery, a discectomy.
Wow.
And I was like, I'm not quite ready for that, because being in the field that I'm in, I know a lot of times once you have that first back surgery, it keeps going.
It's never the same.
Exactly.
It's never the same.
So I decided that I was done with hurting all the time. I had high blood pressure for about 15 to 20 years and was on medication for that. I had horrible reflux and was on medication for that. I was pre-diabetic, and I had just discovered that prior to scheduling my surgery. That was kind of a very scary thing, because I had a family member that was diabetic, and I saw everything that she went through. And my cholesterol was getting higher. So seeing the people that I saw on a daily basis, I was scared. As to what was going to happen. My dad had triple bypass in his 50s, and I was just seeing all these things kind of adding up, and my med list growing and growing and growing, and I was like, enough's enough. So
you started looking into weight loss surgery.
Yes, and initially when I was at my heaviest, I had qualified for weight loss surgery through my insurance, but I was working with a bariatric clinic, and I decided to try like a supervised diet and medication and stuff like that, and I actually lost enough to disqualify myself from surgery. But the interesting thing is nothing changed. No, not off any medications, no less pain,
still high blood pressure.
The same thing. So basically I was like, I'm stuck.
Correct.
So I was still determined, so then that's when I did a lot of research, and I found you. So
what you think initially, because it's like crosses your mind, it's like Mexico. I'm going to Mexico. I'm really doing this, right?
Yeah. Well, and I mean, it's scary, and you do hear horror stories about people that make snap decisions and don't do their research, but I think probably because of my background and the hospital that I work at, we see the worst of the worst case scenarios and what happens.
Correct.
I knew I was going to have to do a lot of research. So I did the research. I looked on not only your website, but I looked on other websites
the credentials,
yeah,
verify
for your
everything.
credentials and for reviews, you know, unbiased, not on your site.
On my site,
Yeah,
it's not me bragging about myself.
Exactly.
Right? Correct.
And everything was positive. And I'm like, okay, this has got to be a good thing. So.
And you decided to have your surgery how long ago?
It was 2 years ago in May. So almost exactly 2 years.
2 years. And you've lost how much?
From my heaviest weight, I've lost 70 pounds.
70 pounds. Congratulations.
Yep. Thank you very much.
Very inspiring. And since I saw you again yesterday, I mean, you really don't look like you had a weight issue. I mean, that good. Yes, I know. And well, tell us now, of all the metabolic issues, the high blood pressure, the prediabetes, the cholesterol, I mean, how did that help?
Well, I mean, I immediately noticed changes, with my blood pressure. So I immediately started being able to wean myself off the blood pressure medication. And now I'm taking none. And then I'm not taking anything for
cholesterol,
pre-diabetes. I'm not
taking metformin or
no, nothing like that. And actually, another benefit is that my lab work, I was in the low normal range as far as my thyroid levels. And since I was so exhausted all the time, my doctor put me on thyroid medicine. So I immediately was able to get off of that. I was able to completely get off my blood pressure medication. All of my lab values look very good, and I feel so much better. And I just remember, walking out to my car from work when I was heavier, and just like it was all I could do to walk up that hill to my car, and I would just be exhausted after work every day. And that is no longer the case.
Well, it's very important to mention that, I mean, some people don't see the sleeve as a real metabolic surgery, and it is.
Oh, yeah.
It has that positive effect toward diabetes, as you've seen, high blood pressure, cholesterol, triglycerides, and many more issues. So you did see and feel and experience these effects from the surgery, the metabolic effects. Let's talk about the aches and pains.
Aches and pains on a daily basis are gone.
Completely
gone. I still have herniated discs. I still have arthritis.
That doesn't go away. Yes.
That doesn't go away. So if I physically overdo it, then I will feel some aches and pains, but nothing on a day-to-day basis.
Good.
Nothing.
Good.
So, I mean, when I was heavier and close to the surgery, I started kayaking with some people and with my husband. And, I just remember getting out of the kayak and just barely being able to stand up straight. And I'm like, this is so much fun, but it hurts so bad. And now I have my own kayak, and we're going kayaking, like every weekend in August. We've got trips planned, and, just...
Life is different.
Yes, it is.
Yes.
It is very different. And I can work without pain, and I can play without pain. So it's wonderful.
That is what we call quality of life.
Yes.
That's what it's all about.
Yes.
Yes. That's what we're trying to achieve with surgery, is just extend your life and have a better life, better quality of life. So, well, I really appreciate sharing your story, and I appreciate your trust in coming all the way down here again. That means the world to me and to my team, and bringing your college friend for surgery. But the most important thing, I want to thank you for sharing this with others, because as I mentioned earlier, you're helping other people, which most people wouldn't do it, or some people are kind of like a jealousy, they won't share it. I appreciate you being so open, and the support giving out to other patients that are looking into weight loss surgery.
Right.
Yes. Well, thank you so much for everything again.
Well, thank you very much. I appreciate it.
Yes.